Welcome to David Charis Pharmacology. In this video, we are going to be looking at pharmacokinetics, drug distribution. Now, drug distribution is a process whereby the drug is distributed from the systemic circulation into the target tissues and cells to elicit its pharmacological effect. So we have the drug in the bloodstream. This is drug A in the bloodstream. This is the blood vessel or the capillaries, anyone you want to choose. These are the target cells or tissue. There are several factors that can affect this distribution of the drug. From our absorption class, drug absorption class, I spoke about transport mechanism. So the transport mechanism can affect the distribution of the drug because this drug we also have to cross the endothelial cells of the blood capillaries and also cross the cell membrane of the cells to get inside the cell or bind to certain receptors of protein at the cell surface. So one of the factors that affects drug distribution is blood flow. Organs that are highly perfused have high distribution or have high drug distribution than organs that are of low blood perfusion. Organs like the heart, the brain, the kidney, the liver are highly supplied by blood vessels. So if I'm to give drugs, I will expect that these drugs are highly distributed to those targeted organs. But organs like the skin or the adipose tissue are, they are not so supplied or they are not well supplied by blood vessels. They are not well perfused. So blood flow can also affect the distribution of the drug. Another factor is the capillary permeability. It can affect the distribution of drug. Now, there are some organs like the kidney. This is the kidney. Okay, let me draw the kidney, the beans shaped kidney, and so forth. I hope I'm drawing this well. They are supplied by, let's say these are blood vessels. They are supplied by blood vessels. And I say that the kidney is highly perfused, right? Now, the capillaries of the kidney are highly fenestrated. They have fenestration. So let's say these are the capillaries with holes in the kidney. These holes are called fenestration or pores. So they are highly fenestrated. Of course, if I'm to give a drug, this drug will come out of this fenestration and they'll be distributed to the kidney. So capillary permeability can also affect drug distribution in the body. Targeted organs or tissue cells like the liver, the kidney, the brain, no, not the brain now, the kidney are highly fenestrated. They have capillaries that, that are deep into tissues and cells of this particular organs. Now, for the capillaries of the brain, let's say this are the capillaries of the brain. This is the brain cells, right? The capillaries of the brain forms tight junction together with the brain cells. This can affect distribution because we would need a highly super I said highly super lipophilic drug. This drug has to be super lipophilic drug to diffuse into the brain cells. An example of highly super lipophilic drug or substance is alcohol. It diffuses into the brain cells. And this tight junction formed by these brain capillaries is what forms what we all know as the blood-brain barrier, BBB. So capillary permeability affects distribution of the drug by forming fenestrated capillaries and also tight junctions and tight capillary junctions like the blood-brain barrier. That is also a factor. Another factor that can affect drug distribution is the plasma protein binding. Now, as you can see from this particular blood vessel, that this is a drug, and of course, the drug is in the blood, is in the blood plasma. Within the blood plasma, we have certain proteins. We have certain proteins that can interact and bind with drugs. An example of a protein is albumin. We should all know this from our blood physiology. Albumin, and we have globulin, which also bind to some few drugs, but basically these are the plasma proteins that bind to most drugs that we take. Albumin and alpha aminoglycoprotein, which is the AAG. Now, basic drugs binds to alpha aminoglycoproteins. Basic drugs like imipramine, lidocaine, um, what other drugs again? What other basic drugs again? Amphetamine, you know, and so on and so forth. But acidic drugs bind to albumin, which is a plasma protein. I think like warfarin, aspirin, and other acidic drugs basically. So plasma protein binding affect distribution of the drug. Now in the blood vessels, let me just clean this for now. Imagine that I have in the blood vessel, I have albumin plasma protein, and I have my warfarin drug. Warfarin is an example of a drug that is highly bound to plasma protein albumin. So warfarin binds to this protein, and the blood continues to flow. The blood continues to flow, and warfarin is still bound for some period of time to the plasma protein. This bounded form of a drug cannot be distributed into targeted tissues and organs unless the drug is free and unbound. So plasma protein bounding affects the drug distribution at various sites, you know. And then we have another factor which is called the volume of distribution. Volume of distribution, VD. Volume of distribution, VD. The volume of distribution is the theoretical volume, otherwise known as the apparent volume of distribution. That means it is not a practical volume. It is not real, but it's a theoretical volume in pharmacology that talks about the theoretical volume occupied by the drug in blood plasma. The volume of distribution is given by the formula VD is equals to bioavailability F times the dose of the drug administered over the plasma concentration of that particular drug. We can also have the formula, the amount of the drug, administered over the peak plasma concentration of that drug. So we use any of the two formula depending on which calculations you are given to calculate the apparent volume of distribution. So talking about volume of distribution, some drugs are, they have a very large volume of distribution. That makes it that means these drugs are highly distributed to every compartment in the body. This makes this make drugs or those certain drugs impossible or difficult to remove from the body in the case of an overdose. So let's take let's look at the compartments that that are in our body that has a particular volume that can be occupied by a given drug. So let's take the vascular compartments, which is, of course, the plasma volume, the tissue compartment, which is the interstitial volume, and inside the cell, which is the intracellular volume. When you give some certain drugs, Certain drugs get equally distributed in the plasma volume, the tissue fluid, which is the interstitial volume, and also the intracellular volume. Those particular drugs have what we call a high VD, a high volume of distribution. Why some drugs are needed to have a low volume of distribution. An example of a drug like warfarin. Warfarin stays in the vascular compartment. Let's say this is warfarin. It stays in the plasma volume or occupies much of the plasma volume without crossing over to the interstitial space and of course the intracellular volume or the intracellular fluid. These are the three compartments. Warfarin have to be in the vasculature or have to be in the plasma volume because of its therapeutic benefit or therapeutic value. Warfarin is an important anticoagulant. So it is needed to have a very low volume of distribution of about, I think, if I can remember, 4 uh 4 kilogram per liter or so in the bloodstream because it functions as an anticoagulant. So that is all for distribution. I've talked about blood flow, capillary permeability, plasma protein binding, volume of distribution. These are the factors affecting drug distribution.